I'm here today with Angelica Miskanin. Angelica is a psychotherapist at JFCS Pittsburgh here. Hey, Angelica, how are you doing today?
Hi, Jordan. I'm doing well today. Very good to be here.
Thanks. Yeah, we were just talking a moment ago about how lately, when we say, how are you doing? Normally we kind of automatically say, fine, everything's great. And now it's more complicated than that. And I think it's more complicated than that for everyone out on the street, as well as mental health professionals like the two of us. Now, I know that you talked recently in the Jewish Chronicle about how taking care of your own mental health is something that during a time of a pandemic is something that you've been paying attention to recently. What's been one of the key things that you've learned about doing that during this time?
Well, what I'll say to that is that I'm still learning what works for me all the time because there have been so many phases to the pandemic. But one thing that I've tried to be most consistent with throughout the pandemic is to focus on gratitude and what's going well. That's sometimes a challenge. Not every moment of the day do I feel like I can achieve that. And I don't know if it's realistic for most people to achieve that every moment of the day, right? It's been important for me to also sit with really hard feelings and mourn many of the losses that this year has dictated. But I really do strive to return to gratitude on a daily basis and really focus on what successes there are.
I'm wondering, do you feel that mental health professionals have been impacted differently by the pandemic than, other people in the community? Are there certain ways in which professionals have maybe unique challenges or challenges that are a little bit different?
As therapists, as counselors, we hold quite a lot. We hold space for people, as you know, to be able to mourn, to grieve, to vent, to express whatever it is that's coming up for them. And what's unique about this time is that mental health professionals are going through it along with their clients and dealing with our own struggles. As I said before, I feel like there have been many phases to the pandemic. And so there have been some highs and some lows. There have been pros and cons to working from home and doing teletherapy. And so I think every therapist or counselor is dealing with their own lives, working from home, doing telehealth, holding space for themselves, as well as trying to sort of compartmentalize that to be able to focus in on a client's needs. And the lines of not wanting to over-relate to a client's experience start to get a little blurry, right? Because there is so much that we can actually relate to, which is sometimes helpful, but it's something to always keep in check.
Right, right. What's one thing that you find yourself telling all of your clients that you think could help anyone that's going through a difficult time right now?
One thing I say to my clients ad nauseum is you can't pour from an empty cup. And I encourage them to find ways to refill. Any individual can interpret that for themselves. What does it mean for you to refill? I encourage my clients to focus on moments of joy or small wins whenever possible. So early on in the pandemic, folks would hear feedback that they should be taking this time to learn a new skill or clean out all their closets or finish big projects and be extra productive. But that hasn't been the reality for many people. That kind of messaging can, not always, but it can lead to people feeling a sense of not accomplishing what they should accomplish, perhaps. And that can lead to a negativity bias or even a shame cycle for some people. So the longer the pandemic goes on, sometimes it feels like a big deal that a person even got out of their pajamas that day or took a walk around their neighborhood. So whatever feels like a victory for someone, I encourage them to try to focus on that and give themselves permission to notice whatever they can give themselves credit for. And again, finding those ways that help them feel like they're being restored or recharged a bit.
That's a really interesting point. It sounds like the things that give us pleasure or the things that we consider accomplishments during normal times have shifted. And right now, because this has dragged on for so long and because we're limited in so many ways, it sounds like you're suggesting rethinking what's an accomplishment, what's an achievement, what are victories that we should be focusing on and celebrating and giving ourselves credit for.
Yeah, small wins, as I call them. Really, I try to help clients feel like they can take some of that pressure off themselves to do great, big and grand things if that's not where they are mentally, emotionally, spiritually, and to, again, to find those tiny victories if that's what really helps.
Great. Well, thank you, Angelica, for joining us today and for sharing your experience and your thoughts about coping during this pandemic.
Thank you, Jordan. Thank you for having me.